Welcome back, everybody. Well, it is Stroke Awareness Month, the month of May is, and joining us to talk a little bit about it and some of the warning signs, some of the things that you can do to prevent a stroke is Dr. Joffrey with the Affinity Medical Group. Good morning.
Thank you for having me.
Thank you for coming. You know, when they do these awareness months, I think it's a good time to just, take a look at yourself, your family, maybe some of those things that you might be ignoring, the way you're eating. You were very happy with the salad we made today, Doctor.
Perfect match.
Thank you.
Perfect
Thank you
match.
so much.
You know.
So, yeah, tell us a little bit about a stroke and what are some of the warning signs and prevention?
Stroke is a loss of metabolic function of the brain. So, certain onset symptoms of weakness, numbness, speech difficulties. Most of these are because of the occlusion of the vessel or blockage of the vessel in the brain. No, there are roughly around 700,000 strokes a year. That's roughly close to, one stroke every 45 minutes or so, every 45 seconds, so excuse me. And so therefore, it's an important disease which we need to talk about to prevent for a prevention purposes. What is driving the stroke tsunami at this point is really the, diabetes, hypertension, obesity. So heart healthy diet is very refreshing to see. Your salad that we talked about, and it's important for us to be aware of this tsunami of the stroke, which is also associated with the difficulty with the memory and cognitive functions issues.
So obviously all the stuff that we hear about doing, eating well, exercising, those are things to ways to prevent a stroke. When we hear about a stroke, though, usually, as you said, it happens, it's quick, it's a sudden thing. But are there some warning signs? So if you feel it coming, that you shouldn't ignore?
Certainly, we do have something we call transient ischemic events, which can occur a day, 2 days, or even up to a week earlier than before you have a large stroke. And those are, again, visual loss, numbness, speech difficulty, balance difficulties. If you have any of those signs or symptoms, you want to get to the hospital the quickest and earliest, because we do have interventions we can do early on within first 3 hours to protect the brain tissue and have a better outcomes for recovery.
You have a full team at Affinity that deals with stroke victims and getting them back to the recovering, and they do these days we've come so far, correct?
That is correct. The stroke management now is based on early interventions. We have medications we can dissolve the clots. We have intervention catheter-based therapy. We have an excellent team of dedicated healthcare providers, physical therapy, occupational therapy, speech, and we are able to improve the function of these patients and have a better outcome than what we used to have even 10 years ago.
How can people get a hold of you if they're interested in coming in? They've got some of these symptoms that you've talked about, and they want more advice.
Yes. Our team of dedicated professionals are available 24 hours a day. We are at the Mercy Medical Center in Oshkosh. We're at St. Elizabeth Hospital in Appleton. In addition to that, we have outpatient neurology service with my 5 other colleagues and 2 nurse practitioners who are able to evaluate and treat entire spectrum of neurological disorders, not only strokes.
All right, thank you so much, Dr. Joffrey. Again, May is Stroke Awareness Month, a good chance to take a look at yourself, get in for a checkup if it's been a while.
Definitely.
Always better to be safe than sorry.
My pleasure to be here.
Thank you.